Hi, Austin Mayor Steve Adler. Got a minute? All right, so it's Friday night. We won't take that long, but let's go through the numbers. They're looking encouraging tonight, so it's a good way to head into the weekend. We're going to start with the dashboard that has the key indicators for sharing. We'll always begin with new admissions. Number is 12. One of the lowest numbers that we've seen in a while, so that's a real good thing. It takes our 7-day moving average down to 20. A couple days ago it was 22. Yesterday was down to 20. The 12 went down to 21, and now it's down to 20. So that's moving in the right direction. I'm really encouraged with the number of new cases, which is down at 59 today. That is compared to the 7-day moving average of 93. Admissions is what we were keying off of to give us our risk code areas. Cases, not quite as reliable a number, but boy, I tell you, if the case number just keeps going down, that's going to be a real good indication for us. We still have another half week or so when we could be seeing an impact from spring break if people weren't careful. So we still have to be cautious, and we still need to wear our masks. Even if you've gotten your vaccine, you still need to wear your mask, especially when you're around people that are also not vaccinated when you're out in the general public. But you can see that the number relatively flat. We've been in the 20 to 22 of 7-day moving average now here for about a week and a half. Let's compare and just look at the hospital numbers. We continue to look at these dashboards. We're getting to the place, I think, where it might not be something that we need to take a look at every day, so long as a community we remain vigilant and continue to do what it is that we're supposed to with respect to masking and the like. Here's the second dashboard. You can see that the number of people hospitalized is 152, the 7-day moving average 155. ICUs at 54, the 7-day moving average is at 58. Ventilators 33, 7-day moving average 34. So these numbers continue to come down relative to the 7-day moving average. Number of people who have passed away, 812. That's one up from yesterday. Still a deadly disease. You just don't want to be the last person to die of this virus, just like, what is it, in war, you don't want to be the last casualty in a war. Same kind of thing here. We just have to really be real careful, and that's what we should be endeavoring to do. A little different view of my home here tonight. Just working with different cameras than we normally do. I like the view of my office here, the extra bedroom in the house, because it lets you see all three of my girls in the paintings painted by their grandfather. Those are the numbers. Today, the question of the local mask mandate came before the court. Judge Livingston denied the state's attempt to get an injunction to pull down the local mask mandate as ordered by Dr. Escott, our local authority. It's good that extends that farther. Every day that we can extend that mask order, it's a victory. It's good. It's been extended the last couple of weeks through spring break. Hopefully that will help. extending the mask order is important because it sends the message and unambiguous communication that masking is still important and it works and it's effective, which is what virtually all of the doctors and all of the data tell us. But at the end of the day, I don't know how this will eventually end up in the courts. I'm sure it'll get appealed to the Court of Appeals and the Supreme Court. We wear masks. We require masks in our businesses, ultimately not because of the law or because the lawyers or the judges said to. We do it because it's the right thing to do. We do it because that's what we can do to keep things safe and to protect our families and the other families. We do it because it is the right thing to do. Yesterday, we had the city council meeting, lasted all day. Just wanted to touch base real briefly with you about that council meeting. We did three things, I think, that were significantly important. We took action to aid in a resilient economy and a recovery. Second, we passed some measures to really take a look at the winter storm, to find out what went wrong and how it happened and how we make sure those kinds of things don't happen again, both the event and our response. We took some action with respect to the public safety, in particular, resilient ATX resolution, something I was sponsored together with council members Tovo and Alter and Casar and Fuentes. And it says, we're going to get a lot of money coming from the federal government. We can spread it out thinly in lots of different places. But what if we were more strategic? What if we said, hey, let's take that money, let's team with Travis County, say, and the money that they get, and the philanthropic community, and let's put resources of a magnitude we haven't been able to put together yet and actually say meet the challenge of homelessness in the city. Could we move everybody out of tents, off our streets, and into homes? We have a unique opportunity with this funding that we may never have again with our piece of the $1.9 trillion coming out of Washington, D.C. Well, the council unanimously said that they told the manager we wanted to take a look at that. And he'll give us a report back on April 12th. I'm excited about having the resources, especially with this summit that's going on this week and over the next couple of weeks to come up with the long-term plan for how our community-driven, finds a better solution for actually ending and meeting the challenge of homelessness. Not only having a long-term plan with exactly how long it's going to take and what benchmarks are along the way to measure progress, hold ourselves accountable, but also the short-term plan to really begin to take people out of tents and out of encampments in a way that the public can see. But that was the resilient ATX resolution. We also supported a resolution by Councilmember Fuentes supporting vaccine access by local area employers, education outreach, time off, urging for frontline workers so that they could get vaccinated. We took some action on public safety. We went ahead and took the step to really initiate another cadet class for the police. Still a lot of work to do before this class will start on June 7th. We need to make sure that the curriculum and what's being taught and how it's being taught is consistent with the values of the community, taught with a way that really emphasizes de-escalation, that focuses on police role as being guardians and not so much warriors. It's kind of the wave of where this conversation is going across the country. We have community groups that are engaged in this, doing great work, but we also need cadet classes. At the same time, we took the action at the budget a year ago where we stopped cadet classes. We said at that time that we would take another look, maybe start cadet classes back up. which is what's now happening. We set a force level back then when we were taking all those actions, and right now we're below that force level. Still will be even after this cadet class. So we need additional numbers. We need to do both. We need to make sure that we have the classes. We need to make sure that those classes are right. The other thing we did was we confirmed the appointment of Assistant Chief Chacon as the new police chief, interim police chief in the city. So congratulations, Chief Chacon. Look forward to working with you. He testified up at the state legislature yesterday on behalf of the city, and I understand did a real good job. Finally, resolution item from Councilmember Tovo, initiating audit in several different places of the storm event, both with our auditor and with the city council and with a community empowered group to get updates and really investigate why it is that things happen the way they happen, the rolling blackouts, the availability of food and water, everything that went into it, so that we can learn lessons. City Council will meet again on April 8th. Remember that beginning Monday, anybody in the city is eligible to get a vaccine. You can get vaccines in lots of different places around the city, including Austin Public Health, though, but most of the vaccines in the city are being gotten other places. So you don't need to just wait for that. With that, this is the weekend, Friday. You all have a really good one. Be safe. Take care. And we'll talk next week.